The spinny circle has ended and we are started. Glad to be here with both of you and anybody out there who is watching or listening. Welcome back to Addiction, Recovery, and Mental Health, a podcast by Waismann Method opioid treatment specialists. This is a special episode where, for one reason, is because of who's joining us, but also because we are recording the video and audio of this, and it is being released on both mediums. If you're hearing us on the audio podcast, just be aware you can check the social media, or you can go to our website, opiates.com, and check that out. There will be links and things here to be able to watch the video of here. We are at Opiates on all the social media as well, that you can find out there on your Instagram and your Twitters or whatever that's called now. So glad to have all the people viewing as well as listening. And we are doing a little bit of a reintroduction. We're here with you a couple times a month, but I'm gonna let everyone know, especially if you're joining us for the first time, who we are joined by, which is really exciting. I like to go, I like to start with the least qualified person in the room, so I'll introduce myself first. My name is Dwight Hurst, and I am the producer of this podcast, as well as I'm a psychotherapist with experience in trauma and addiction, also a podcaster. So I spend most of my time doing public promotion, education, and treatment and therapy as well. I'm a licensed professional counselor and glad to be here to learn from the individuals here. I also co-host this podcast regularly with David Livingston, who is here, licensed marriage and family therapist. I'm getting your credentials right, David.
Yeah.
You are. And you've got really, really in-depth experience and expertise with opioid, particularly in alcohol addiction recovery. And you, as you do to the program all the time, bring very personalized psychotherapy approach and understanding of how people work. So, David, glad to be here with you. We also have Dr. Michael Lowenstein, who is really one of the premier authorities in the world on anesthesia-assisted opioid detox, and also the medical director, if I get your title right, here at Waismann as well, working with that, and very grateful. We've had you on the podcast before, and being together here for today's topic is very exciting. So welcome, Michael, as well. We had a little glitch. David, you're back. So today we're talking about a very important theme that is I really near and dear to our hearts and to the purpose of this podcast, why we started it in the first place. But we're going to be focused on opioid detox and really the myths versus the reality of that process. We're going to dive a little deep into the process of medically what's going on with detoxification. There's a lot of exaggerated claims out there. On one end, you have people who will promise the world when it comes to treatment and detoxification. On the other hand, you have a lot of myths where people have a lot of fears or misconceptions about that as well. And we're going to try to put some of those to rest. So let's, gentlemen, let's dive in. If you guys are feeling ready, I'm going to pull up. We are driven by questions here on this program. And so we're going to go into some of those with the Waismann Method Rapid Detox program. It would be good. Let's start with kind of a definition of what does that mean when we say rapid detox? And Dr. Lowenstein, do you want to start us out?
Yeah, so the term rapid detox is used a lot. When I talk about rapid detox and specifically what we do, rapid detox is basically anytime you perform a opiate detoxification procedure where you're using sedation or anesthesia in combination with introducing an opiate antagonist, which blocks receptors and accelerates the detox. So rapid detox is, takes on a lot of forms in the media and on the website, but basically anybody that can introduce anesthesia or sedation or do the detox under those medications and accelerate the process with use of an opiate antagonist and therefore transition somebody to the antagonist. It's pretty much what rapid detox is.
Mm-hmm. And I think when people talk about detox, the sort of old school mentality is that we think of it as something that's painful. We often use the term on this podcast of, a basement, a blanket, and a bucket, right? I mean, that's the images that come to mind when people think about withdrawals. Very, very dangerous, obviously. And then, of course, detox. I find that people don't know as much about it, particularly when you're talking about the use of sedation. Could you talk a little bit about what are some of the benefits to that, of doing it that way versus, well, certainly the basement version is not very good, but rapid detox versus some of the more old school detox techniques?
Yeah, so there are a lot. I think a lot of the fears and misconceptions are that people just don't understand what actually happens with rapid detox. And there's a lot of different things that are being performed in the community. So I can speak specifically to what I do at the Waismann Method. So the goal of rapid detox is safe, comfortable, effective opiate detoxification, because a lot of people avoid detoxing because of the fear of the withdrawal and the horrible symptoms that they experience. And oftentimes that's the reason patients will tell me that's the reason why they continue to use, because they just can't tolerate the withdrawal, or they've undergone detoxes which you've described, where they basically are, just experience all the withdrawal symptoms. So the purpose for rapid detox is to be able to control the physiology, to be able to avoid a lot of those symptoms. So with what we do, I think there's few very key things. So I'll bring a patient into the hospital the day before to really be able to evaluate their underlying conditions, right? So the majority of patients that show up, they're dehydrated. Sometimes they're hypertensive. Sometimes they have medical issues which they are not even aware of. So the day they admit to the hospital, we do a physical examination. I work with an internal medicine cardiologist who helps co-manage patients. So we do a significant evaluation where we'll check blood work to check liver, kidneys, thyroid, pancreas. We'll do an EKG, a chest x-ray, and depending on the patient's age and underlying medical conditions, we'll even do echocardiograms or exercise stress tests. So in order to be able to do this safely, you have to have a really good understanding of the patient's underlying issues and physiology. And then by admitting a patient's day before the procedure, then we can actually optimize their physiology. So we can hydrate patients. If their blood pressure is out of control, we can manage that. If their blood sugars are out of control, we can help to manage those things. And then we pre-medicate for the first day to block the part of the nervous system that causes withdrawal. And that's what allows me to perform the procedure safely, effectively, and to minimize, the symptoms. And then the next key is that I actually do the procedure in the ICU setting, where the patients are carefully monitored for a full 24 hours. And so I can introduce sedation, so they don't remember or feel anything. Because of all the pre-medication that they were given on the day of admission, their physiology remains nice and stable, because the majority of withdrawal is related to the sympathetic nervous system. And that's why when patients are withdrawing, you see high blood pressure, high heart rate. It affects their gut. It affects so many body systems. So we, first of all, help to stabilize those with pre-medication, and then use anesthesia or sedation so the patients don't remember or feel anything. We can control their physiology and then carefully monitor them in the ICU setting for a full 24 hours. So we're keeping the patients comfortable. We're monitoring them closely. We've already optimized their physiology to reduce risks. So I think the combination of the evaluation, the pre-medication, the optimization of their physiology, and then the very close monitoring allows this to be a very safe, effective, comfortable process. And we are accelerating the process into a very short period of time, as opposed to, an unaided detox can last days to weeks to even months in some cases. So we're able to accelerate this into a very short period of time. And when the actual opiate detox is completed, we've also transitioned them to a blocking medicine such as naltrexone, which actually helps to block the physical cravings. So once those first couple of days in the hospital setting is complete, then they can then move on to address all the other issues that are related to addiction and opioid use disorder, and underlying psychosocial and environmental, all the other things that then have to be addressed. But the detox itself is, like I said, comfortable, safe, effective, and we've got them detox. So we've essentially treated the opiate dependence, and that's really what rapid or opiate detox does. Is we're treating the opiate dependence, because I firmly believe you can't move forward to address all the other issues until the opiate dependence has been treated, and we've transitioned somebody to the blocking medicine to then treat their cravings.
It's interesting, like so many things, we place such an emphasis on the thing itself. And when we say detox, we think of the actual process, which is very important. But you're describing how, at least as important, is the pre and post reactions, right, to the actual procedure. I would say, at least it sounds to me like we're saying that that's at least as important. Do you do the proper prep, and do you do the aftercare? Otherwise, the thing by itself is not the only focus.
Exactly. I think the pre is of utmost important, because you really have to understand the patient's physiology and where they are medical, because treating opiate dependence is a medical diagnosis, right? It has to do with the patient's physiology. They've taken opiates for a long period of time. Their bodies become dependent. If they stop the opiates, then they develop a withdrawal syndrome, and that's medical or physiologic. So you have to use a medical approach to understand the patient's underlying physiology, understanding what they're using and how much of it, and to optimize their physiology, their blood pressure, their heart rate, their hydration status. Patients will show up with abnormal electrolytes like potassium and magnesium. So the pre part is very important to optimize the patient, to prepare them for the actual detoxification process. And I believe that the process itself is important to be medically managed appropriately in the proper setting. And then the post is important, right? We've talked about using the antagonist naltrexone to keep those receptors full and to block the physical cravings. And that's what allows patients to move forward to treat all the other issues that related to addiction and opiate use disorder, and all the neurobiologic, environmental, all those things that will then potentially take weeks to months or years to address. But you can't address those until you've dealt with the physiologic or the medical diagnosis of opiate dependence.
And for both of you, David, you may chime in on this too, with an insight to some of the emotional or psychological prep for coming into a detox. What do you think are some of the things that are important to be prepared for in that realm?
Probably the most important thing is feeling committed to wanting to be off of the opioids and feeling ready to go through the process, and then creating some sort of structure and understanding as to why you're on them in the first place and what you're needing to sustain staying off of them. And then all the other factors, like Dr. Lowenstein is bringing up, that can contribute to them. A lot of it has to do with, one of the worst things from a emotional standpoint is when people are on opioids, especially long term, they lose a sense of agency. So the opioid starts to dysregulate them. It's also a depressant long term. So there's all these effects, which is why we treat we detox them before we start to work on the other things, because once that is in place, you can begin to sort of bear down on some of the other issues. And so part of it is just coming in with an openness and a willingness to explore and try to understand.
Yes. And of course, there has to be awareness that there are going to be medical situations that maybe have been covered up by long-term opioid use. I may not know that I've developed other health problems that I didn't have when I started to abuse opiates, and being prepped for that, both from a standpoint of survival or lowering risk of the process, but also preparation for adjustment. Adjustment is a huge part of this, even pre-planning. The word Well, go ahead, David.
Well, I was just going to add to um, what Dr. Lowenstein does medically is pretty amazing, because people come in with all kinds of conditions that have been untreated, and also sometimes on different medications, and on medications, other medications than they even thought they were on. So so what he assesses and puts together in terms of getting them off of it, and then the work we do at Domus after the detox, in conjunction with Dr. Lowenstein's oversight in terms of keeping people safe and getting them healthy quickly, is it happens pretty quickly.
Mm-hmm. Yeah. It'd be good to highlight a little bit. What are some of the effects on the dependence level? People have built up a tolerance oftentimes before detox. Can we talk a little bit about that? The physiological reality of reliance, dependence, all those kinds of things that come after detox.
So from the medical standpoint, the patients have taken an opiate for a period of time, so that causes changes or neuroadaptation in several different parts of the nervous system. So it affects your neurotransmitter production, it affects hormone production, it affects receptors. There's a lot of different brain circuitry that's affected by this. So the body becomes dependent on it, which means if you stop, you have a withdrawal. And then a tolerance develops, which means that patients will require more and more of the same medication to have the same effect. And then there's also, with opioid use, you can get hyperalgesia, where it causes changes in other parts of the nervous system where you're more sensitive to pain and less tolerant of pain. It affects, mood and all those other things. So there's a lot of effects. And one other thing I might mention is that the patients, as we know, that fentanyl, the majority of what's on the street today is fentanyl, right? The heroin's fentanyl, the fentanyl's fentanyl, the oxycodone is fentanyl. But with that, I'm seeing more and more patients showing up when we drug screen them when they come into the hospital. They're also positive for methamphetamine in the majority of time. We're seeing cocaine, we're seeing marijuana, we're seeing alcohol. So in the majority of patients, we're not just treating opiates, we're treating all of those different dependencies, and the withdrawal from each of those looks a little bit different. And so the monitoring that's required, and the symptoms that they may or may not experience afterwards. And then dependency also affects everyone differently. Everyone seems to have one body system that's more affected than others. A lot of times it's the gastrointestinal system. Majority of the patients I treat have sleep disorders, and oftentimes they're using the opiates because they're not sleeping, or they're anxiety, depression, bipolar. So we're dealing with a lot of different issues. And so it's interesting, in the pain patients that I treat, they'll stay on the same opioid dose for a long period of time, and they don't seem to get as tolerant. I think the tolerance in most of the patients that use opiates to treat underlying emotional or underlying issues such as that is they get very tolerant to the emotional component that they get or effect they get from the opiates. And that's why I think the dosages escalate so quickly. And now with the new fentanyl that's on the street, I'm seeing escalation unlike I've seen in my 25 years of doing opiate detox. It goes from, if they're using the Oxy Blues, it goes from 1 to 2 to 10 to 20 to 40 to 50. It's just extraordinary how addictive the fentanyl on the street is right now. So I think all of that plays a role in, the tolerance and the dependence.
Mm-hmm. And opiates are historically have always been overdose risks go up after someone is no longer chemically dependent, because their tolerance is so low they may use what they used to use and die. And you're describing some of the social just elements out there with fentanyl and everything, the practical reality that's even more dangerous now. So
yes,
relapse becomes very, very dangerous.
Right. So you're absolutely correct. Once the patients the opiate dependence has been treated, their tolerance is back to the same level as it was prior to using opiates. So if they go back to trying to use a dosage that they were previously taking, the risk of overdose and death is very, very high.
Yes. Okay. You hear the word holistic kicked around a lot nowadays, and I think that when you hear a word a lot, sometimes it loses a little bit of meaning. But that is one of the main focuses of the Waismann Method approach, is to have a holistic practice. Can we talk a little bit about what that means so people know what they should look for when they hear that word?
From a medical standpoint, so we're using medicine, pharmacology, physiology, anesthesia for the actual treatment. But once the opiate dependence has been treated medically in the hospital setting, and we've transitioned the patient to the naltrexone to block the physical cravings, I think that's where you need to take a very holistic approach to treating the issues once the dependence has been treated. And so in my mind, from the MD standpoint, patients will ask me, what can I do to make the recovery quicker? Your neurotransmitters, your hormones, your receptors, all those things have to rebalance, and they'll find a new normal. Some people talk about pre-opiate use normal. Well, as we age, our normal changes. Once people have used drugs, we don't know what normal is anymore. But to help people establish their new normal as quickly as possible from a holistic approach, I will talk to them about, well, you need to address the psychological issues. And in our aftercare, David, is the first step in that process. Good nutrition is important. Vitamins, good nutrition. Sleep is very, very critical. And exercise. And if you use that holistic approach of therapy, sleep, exercise, nutrition, that's what's gonna help people achieve their new normal as quickly as possible.
Yes.
Right. So when people say, I want to feel normal, what they really mean is I want to feel good, because everybody remembers themselves when they felt well. And so, and certainly that is the goal. And as Dr. Lowenstein pointed out, sleep, exercise, good enough nutrition, and then I might add to that good experiences with people. And then also, if you're in therapy, you've got to deal with anything that's inhibiting you from feeling well, right? So if there's an underlying anxiety or sleep disorder or anything else, and sometimes it's just situational. Sometimes people are overly burdened by the amount of responsibility and work and everything else. So situationally, they're and that can dysregulate you and overburden you. And sometimes people use opioids just to cope, to sort of keep their life functioning. We see a lot of people where so it's really dependent on what their need is. And from my perspective, holistically, I take the time to really understand and differentiate what those needs are.
Mm-hmm. Dr. Lowenstein, let me ask you this. Some of the post-care that people obviously have to, part of this healthy adjustment is taking responsibility or taking ownership of their medical care. Do you see people, what are the needs that they have to set up as far as with their own care professionals? Are there certain types of medical things they should be prepared to have checked or to do after? Really, I'm asking a big question with a process that needs to be very individualized, but what would you say about that?
Yeah, so when people use or abuse opiates, they oftentimes will neglect their underlying health conditions. So part of the process when they come to see us is that, we get the initial labs and EKGs and chest x-rays, and oftentimes can identify the underlying medical issues that they're aware of and haven't actually taken good care of, or oftentimes there's things that they're totally unaware of. So, that's an opportunity to identify after the detox, what needs to be addressed. And a lot of times patients don't follow up with their primary care doctors when they're on opiates because, they have concerns about, them finding out or having to discuss that. So we identify those issues, and I'll point them in the direction, and I'll share their laboratory results with them and say, you need to follow up with your cardiologist or your internist or your diabetes doctor, because these really need to be optimized and controlled as part of your recovery. And then if there's apparent underlying psychological issues that need to be addressed or have been addressed in the previously and just been ignored, I will encourage them to follow up with their existing treaters, or maybe, point them in that direction. And then David, I also will help them identify, and, from a psychological or behavioral standpoint, ways that they can optimize their care.
Absolutely.
Yes.
Well, and I know, Dr. Lowenstein, you have to leave us. David and I could talk a little bit more about those, some of those things. But before you go, would you like to? We're in a sort of an anniversary time. It's been about 24 years that Waismann Method has been around. Is there anything you'd like to say about, particularly into the tailored approach that you're able to take in a clinic like this before you go?
Yes. And so there's one other thing I'd like to mention, which I haven't, is that part of the problem with people who are with rapid detox is that there are programs that'll tell the patients that they'll bring them back to the biology of their pre-addiction state. And I think that's very dangerous, because I discuss, we'll bring your body will find a new normal, and we'll help you achieve that once you're no longer on opiates. But I think that discussing bringing people rapidly to a pre-addiction state is very dangerous, and it's very misleading, because as we talked about, you can treat someone's opiate dependence very quickly and safely using a rapid detox, in the proper setting with the proper pre-evaluation and pre-medication. And you can introduce the blocking medicine, naltrexone, or an injectable form of Vivitrol to block the opioid cravings or the physical cravings, but you really can't reestablish a pre-addiction biological state. Because I mentioned there's a lot of neuroadaptation that takes place with chronic opioid use. It affects your brain circuitry, and it affects your receptors and your neurotransmitters and your hormones, and those take time to fix. So if somebody gets detoxed and think they're cured, then they're not going to get the treatment and the help that they really need to be successful long term, right? Because if you only treat the dependence and then tell them you're fine, then it really does patients a disservice. So that's one point I just wanted to get across. After having done this for 25 years, I think we've demonstrated that in the proper setting, in the proper hands, that rapid detox can be very safe, effective, humane. And what we're basically doing is we're treating the dependence, transitioning the patients to the blocking medicine so that they can really address the underlying issues that are going to make a long-term difference. Because addiction's always been known as the revolving door, right? So if we can really provide appropriate treatment and get them pointed in the right direction, then the goal is to stop that revolving door, to really give the people opportunities to address this properly. There's nothing that gives me more pleasure in this. Well, number one, to get people off the opiates and get them pointed in the right direction, but get those calls a year later, 2 years later that, I've got my life together. I've got a great job. I'm married. I have children. And that's what really makes this worthwhile. And I think being able to do this safely and effectively and comfortably is really why I'm still doing this almost 25 years later.
Yeah, that's one thing. Speaking as the outsider I've come in to Waismann, my introduction has been doing this podcast. And one of the things that I've really enjoyed and believe strongly in is the approach you guys take of on the one hand, providing here's the treatment that's going to get you where you need to go, but also explaining both the limitations and the opportunities of the reality of detox and post-detox. And so, yeah, it's something I really appreciate as well. So glad that you could share that, and glad you're able to be with us. I know that you have things that you're taking care of, and it's always great to be doing things instead of just talking about them. So it's good that you are there and working. Thank you so much for joining us. For
My
this part.
pleasure.
Yeah.
Thank you for the opportunity.
Thank you.
Thanks, Michael. Thank you.
And so for David, now that I wanted to focus on a couple of questions about some of the emotional transition. One of the questions we have is, what are some of the emotional challenges of even just imagining and picturing that my life will no longer involve opioids when I'm coming in for treatment?
It takes a little while so one of the things that happens is a patient will, after the detox, they'll be dysregulated, usually have some trouble sleeping, and have some level of feeling uncomfortable. It's impossible, even though they're fully detoxed. Right? There's no titration of the opioids left. The only exception to that could be with some methadone, which we also detox people from, but some of that, there is a small amount of titration left. But with regular opioids, it's over. But they don't feel that necessarily immediately, because the nervous system and the whole system has to adjust. But what happens is, as soon as we start to get them to sleep, and that's usually the biggest hinge in terms of the recovery shifting pretty dramatically. So as soon as they start to get some sleep, and we also assist with that, Dr. Lowenstein does with medications, because at that point in time, the goal is to get people feeling more like themselves, healthier, quicker. So the use of medication truly is medicinal. Otherwise, the suffering tends to be, as I like to say, neurotic rather than existential. Right? Suffering that was leading nowhere rather than suffering that's actually getting us somewhere. So we assist in that. And the program is meant to get you back on your feet and feeling like yourself as quickly as possible, safely, obviously. So, and what Dr. Lowenstein does is frankly pretty amazing, given the complexity of the patients he sees, and which is why they take great care even before the detox, to check everything out. Yeah. And so by the time they get to me at Domus after the hospital, they are tired, feeling a bit wrung out, and then we use medications to help them get back to themselves and wean them off those. Not that they're not going to develop any physical dependencies from what they're being given. It's really just medicinal. And then what I hear is, like, a few days later, they're like, I can't believe I'm off of it. It's like, they can't believe it. They've been on it. And then thereafter, the emotional life, our emotional life learns slower than our intellectual life. So I could tell you something, it could be completely true, but until you're feeling it, until emotionally there's been enough time till you felt well without an opioid, it doesn't sink in deeply. So as time goes by, there's even further improvement psychologically, because they start to relax more. They realize, I've been off it for 2 days, 3 days, 4 days, 5 days. I'm fine. And right. And even so, then there's a progression just from that perspective.
Yes. Wow. What are some of the emotional obstacles or the strong presenting emotions when people are going through that? You mentioned they're all wrung out, they're tired, there's hope, but there's also, there's also emotional feelings and cognitions that get in the way as well, or that can be mixed feelings, let's say, or whatever. What are some of the things, the emotions you see presenting themselves?
That's so individual and so broad, but one of them is, it depends. It depends significantly, and I've seen so many people and worked with so many people. I can usually tell when someone, in the first 5 to 10 minutes when I'm talking to someone, where they're at in terms of wanting to be off the opioids. Like Dr. Lowenstein was suggesting earlier on, the correlation emotionally to being done with them, wanting to move on, it affects the physiology of how well they do. So people who are still conflicted about it, are unsure and so forth. And usually, by the way, as they feel better, I mean, you have to understand, many of the people we treat have been on opioids for, years and years and years and even decades. Mm-hmm. So, the idea that I'm going to be okay without it is not something that's really been reinforced. And so time being off of it, all that stuff reinforces, and emotionally they can begin to feel more confident.
Absolutely. What do you say about family and the role that family plays? There's some important ways they can help right after a detox, and there's probably some important limitations there too.
The main thing I say is, look, that's complicated. You have people who are sometimes family members are really supportive and happy that the individual is doing this. Sometimes they're upset for various reasons, and so it depends. But you address things as you need to. But overall, you want to emphasize, or I try to emphasize, the fact that, look, this is positive. Now the things that have been a concern or in some ways associated with the opioid use can be addressed differently, and try to give the person some time. This is a time for some understanding, some patience generally.
Yeah. Yeah. It's one of those things where health in this regard, and some people use sobriety as an overarching term. I know we prefer to, on this program, to usually talk about it in terms of health management, because it gets into this idea that, what does health look like? Health isn't perfection. Health isn't, oh, I got off the opiates, now everything's fine forever. It's like, well, no, that's not what we're looking for. What we're looking for is having the tools to do the hard work in life. And that's one of the things I enjoy, as I see patients who are able to, you peel away that comfort level, and then you have tools to really dig in and find ways to be healthy in your life. So that's one of the things that's rewarding. As we're wrapping up, I wanted to ask you, what are some of the things that you particularly enjoy about the environment and the patients that you're able to see through the Waismann Clinic?
There's so many things. First of all, it's a big leap of faith coming to see us. Usually they've researched and listened or read and so forth, and nonetheless, they don't know us. It's still a leap of faith, and there's something so honorable and so good about being involved with people who want their lives to be better, and then allowing you to get to know them, to help with that and participate in that. And it's fantastic. I meet people of every type of person you can imagine. Mm-hmm. And so it's just, and yet everybody's the same in most ways, right? They all want to feel better. They want a better life. They want their relationships to work well. Things like that. So I feel privileged, and I'm working with a group of people who have been, I've been working with them for 20 years plus myself. It's been and I never was oriented towards this field. I was not going into this field initially. I've been doing this for close to 30 years, but I was not headed towards this. I was trained more in a psychoanalytic perspective, mm-hmm. which also really helps me understand how people are organized and put together. And it's been very useful. And then, behaviorally working out the things that they need to do to stay well.
Absolutely. Yeah. The courage and the ability to be around and get to know individuals who, there's such a huge balance there. And it's amazing to see that balance between both the individualized person and how different people can be in their different walks of life and things. And then yet also the universality that we have when it comes to what makes us human and our emotions too. That's just a very powerful part of this work, to be able to see that everyone's different and yet we're all united as people. So a wonderful thing.
Yes. And maybe the last thing I'll say is that this is for many, many people, and maybe even most, it's a major transition in their life. It's not a small thing. And so to be able to help someone through a major change in their life, and when they really, I'm lucky to get to help them. And so it's, and I'm lucky to work with the people I do.
Yes. Well, and I'm always feel lucky to be here with you and talking about these things. I know for me personally, just even doing this podcast, and I've spent so many years working in psychological treatment and addiction treatment, but I feel like I've become a better clinician and a more well-adjusted person just by being around you guys as well. So it's something I am grateful for and really enjoy. Thank you so much, everybody who's out there, who's been able to listen and who's been able to watch. We want to encourage you to please share this information and to share this program with people. If you have whatever your podcatcher of choice is where you do listen, please make sure to give us good reviews, especially because that does help people to find the show. This is a production, of course, of the Waismann Method Opioid Treatment Specialists Rapid Detox Center. And as we go, I'll leave you with the thought that I always do, which is make sure that when it comes to these issues, as well as anything with your own health and happiness in life, make sure that you keep asking questions, because if you ask questions, you will find answers. And whenever you can find answers, you can find hope. So goodbye to everybody out there.
Great advice. And thank you as always, Dwight.